Now, coming to prostate cancer, it mainly depends on what is your stage or what is your risk factor or risk scoring. So, based on that, radiation therapy is given. If it is a very small disease, early disease, you can even give only brachytherapy. So, sometimes again, brachytherapy is given in two ways. Either some low dose brachytherapy seeds are left inside the prostate that are called permanent implants. So, that can be given. Or otherwise, brachytherapy using tubes also can be given. So, those two modalities are also given most commonly in either early diseases, or sometimes the disease has recurred, then also brachytherapy can be given. Otherwise, generally, external beam radiation therapy is given in prostate cases, most commonly with IMRT technique, or nowadays the standard is more towards IGRT because there is some movement. The prostate gland also moves with respiration and other physiological processes. So to avoid that, IGRT has sort of become more standard nowadays. So with that, we are able to track the prostate, and if there is any movement, we are able to track it and also give radiation therapy only to the prostate and the cancer surrounding it, and avoid completely the other structures. That is also uh, possible. So another thing is SBRT is also given in prostate. That wherever it can be given in a small indicated subset of patients, stereotactic body radiation therapy is also given. So in prostate, how much time does it take for radiation therapy? So if we follow the conventionally, it takes anywhere between 6 to 7 weeks. But there are now the schedules have there are some institutes, there are schedules which finishes in 4 weeks, which is good enough. That is every day, instead of giving just a small dose, a little bit more dose is given so that the prostate can tolerate it, provided that the high end techniques are available, the tracking of the tumor, everything is available. Then we can finish the treatment in 20 to 25 days also. Sometimes if you're giving SBRT, it can be finished in 5 days. So there are a variety of options in prostate cancer. So it mainly depends. It all depends on how, what is your stage of the tumor, what is your PSA. So with that, they arrive at a risk scoring. So on that risk scoring, it is given. So along with radiation, they also suggest hormone therapy in certain stages, in especially in little bit advanced stages or the risk is very high. And along with that, hormone therapy is also indicated in prostate cancer. It again depends. It varies from 3 months to 6 months to 2 to 3 years. So all that depends on what stage and what risk the disease is on. So what are the side effects that may one may encounter? Because prostate is very near to the urinary bladder and rectum. So these side effects are similar even for prostate cancer, even for kidney cancer, or even for any urogenital cancer. Because the main structures involved there are bladder, then behind there is rectum, then hip bones are there. So when we give radiation, most of the patient may experience some amount of diarrhea. Most commonly, it is just very mild. It settles with dietary modification and some antidiarrheals. If it does not, if it is very very severe, then we will have to give them a sort of a temporary break so that they recover from it. So those, that is the most common side effect that can occur. Again, if you're treating the prostate, the bladder may get some dose of radiation. There can be some bladder infection or some inflammation that can cause irritation in the bladder. It can also cause some difficulty in passing urine, which is again temporary, and some urine infection, or sometimes very rarely some blood in urine also can occur. That is again a little bit temporary. Another thing is there are hip bones and pelvis bones. So when those pelvis bones get a large amount of radiation, your blood counts can drop a bit. In the later side effects, even the bone can get a little bit of necrosis. That can also occur. Another thing that can occur in the late side effect is wherever the urine passes, the tubes are there, they're called urethra or urethra specifically. They can get fibrosed because of the radiation. Sometimes in the later run, the rectum, they can have some inflammation called as proctitis. Some amount of bleeding also can be there. So these are all the most common side effects that we encounter. But most of it, because with advanced techniques, the patient is very comfortable. Most of them do not have uh, more side effects. It is very very minimal these days. So with the use of newer technologies and newer techniques, we are able to significantly cut down the chances of side effects for the patient, so that he is more and more comfortable. So these are the techniques and things about urogenital or urology related malignancy in which radiation therapy is used.